Hello all. Today's topic is intervention in Meralgia Paresthetica. There was a 55-year-old female patient who came with complaints of pain in anterolateral aspect of the right thigh, which was started almost like 3 to 4 months ago. She was using some conservative therapy, and in spite of the conservative therapy, there is no significant improvement. So the neurologist had referred the case for an ultrasound. Then NCS were also done. NCS was inconclusive. Then we have to then we have I have done an ultrasound. It was showing compression of lateral cutaneous nerve of thigh. So lateral femoral cutaneous nerve of thigh at lateral aspect of the inguinal ligament, under the lateral aspect of inguinal ligament, just anteromedial to the anterior leg spine. So that if you can see the lateral femoral cutaneous now, it originates from the lumbar plexus, usually from L2, L3 nerve roots, and that runs into the pelvis and passes under the inguinal ligament. So here we can see this is the lateral femoral cutaneous nerve. So once it is passing through that, then there is that it can get impinged under this uh, what do you say, inguinal ligament. Okay. So once it passes under the inguinal ligament, usually divides into anterior and posterior branches that provide sensation to the skin of anterolateral aspect of the thigh till the knee joint. So the patient was also having pain in the similar distribution. So here we can see this is the lateral femoral cutaneous nerve. This is our anterior superior spine. Usually in this area, if you put the probe, we can see the lateral femoral cutaneous nerve. So, what are the causes of myalgia paresthetica? Usually, tight clothing, belts, and heavy tool belts, obesity, or any weight gain. So, which can increase pressure in the groin area, and even pregnancy. So, trauma. Any medical conditions like diabetes and hypothyroidism or alcoholism can cause myalgia paresthetica. So, what I am going to do in this case is do an hydrodissection of the lateral femoral cutaneous nerve of thigh. Okay. So, what I'm going to use for this is I'm going to use an hypertonic um, so medium. So I am taking 25D. So then I'm adding almost like uh, 40 mg of kinocot, that is triamcinolone acetate, and then almost like 3 ml of lignocaine and 2 ml of ropivacaine, 0.2%, and that 25D almost I have taken around 10 to 10 ml. So total mixture was around 18 to 20 ml. So using this, I am going to use the 22 gauge spinal needle. So here you can see this is the 25D which I am taking. This bony prominence is the anterior superior iliac spine, and this is the lateral femoral cutaneous nerve. Yeah. So this is the lateral femoral cutaneous nerve. This one. You can see it like normal honeycombing appearance on cross section of any nerve. Once we identify that nerve, then I'm going to put my needle. I'm checking for any vascular structures nearby. Now you can see this is the nerve. So I'm putting my needle. You can see I'm entering here. I'll follow the needle tip here. I'm readjusting the needle so that I can reach the surface of the nerve. So I'm almost here. Just I reached till the surface of the nerve and checking whether a needle position is correct. Then once I'm there, Yeah, you can see this is maniacal position, just superficial to the lateral femoral cutaneous nerve. Then I remove the stellate and do the hydrodissection with the mixture what we have prepared. Slowly start injecting here. You can see this mixture is coming out, and I'm separating the now from the adjacent soft tissues slowly, starting from lateral aspect and extending into the anterior aspect of the nerve and separating it from the inguinal ligament. This is the inguinal ligament. The hyperechoic band is the inguinal ligament. Almost around 18 ml of fluid. See, I'm separating it layer by layer. The inguinal ligament also later on, and almost separating the nerve from the adjacent soft tissues. This is a nerve. This is adjacent soft tissues where the fluid is there. Post this hydrodissection, the patient experienced immediate pain relief because the cause is uh, Meralgia Paresthetica, that is compression. Ultrasound imaging, I was not showing here, but the nerve was showing fusiform thickening, compression at that level of inguinal um, ligament, and post compression there was a fusiform thickening of the nerve. Yeah, you can see I'm further doing the hydrodissection here, separating that nerve from the soft tissues in all the 360-degree plane. So, what are the other ways where you can treat the Meralgia Paresthetica? Like, so patient is not respond, patient has his response, and if the patient has a recurrent symptoms, then what we have to advise, like lifestyle modifications, losing the weight, avoiding tight dresses, and and if she's not even responding for that, then we need to plan for radiofrequency ablation of that lateral femoral cutaneous nerve. So that is one option, and like lateral femoral now neurectomy in case of severe pain and not responding to any of these treatments will be the last resort. Yeah, thank you.